Hello there, and welcome to today's episode of the Only Endometriosis podcast you need. Today I'm going to be talking about menopause, specifically induced menopause. So this is following on from last week a little bit, and I specifically want to talk about enforced menopause because I know that for some of you it's a very, very real fear-inducing conundrum. And that fear can actually happen at any point. So if you are listening to this episode and you are facing the prospect of surgery that will induce your menopause, if you're faced with the possibility of having hormonal implants or hormone therapy that will temporarily induce the menopause, then please know that even though it might feel like 100% the right thing to do at the moment, there may be moments where you feel anxious, where you feel worried, and that is completely normal. It is a huge decision to make, and the vast majority, I would say, of women I work with who go on to have hysterectomies or who are thinking of inducing the menopause as a result of their symptoms, most of them get to the point where they just say, do you know what, I'm just sick of it, just take it all out, whip it all out. And that might feel like 100% the right decision at the time. So if you are sitting in that space, I hear you. If you're sitting in the space of indecision, I hear you. If you're sitting in the space of not wanting to do it like I was, I hear you. A lot of women I talk to after the event as well, that security, that surety that the decision was the right thing to do, a lot of them still have that. A lot of them have moments of grief, of loss, of anxiety in terms of the future, because obviously they're entering into this winter stage of their life a lot earlier than they probably would have been naturally. So if you're sitting in that space, I hear you too. It's completely normal to have these feelings. Just honour them, be gentle with yourself, and you don't have to go through this alone. So let's dive in. What is menopause? So for those of you who aren't completely certain about what menopause is, I completely get it. Tend not to think about it when you're a young woman. It's just something that's there, lingering, looming, maybe even on the horizon. But essentially, menopause is when your periods stop, to put it in a nutshell. The process of menopause has 3 steps. So the first one is perimenopause, and that's when your hormones are shifting. That's kind of, if we link it to the seasons, that's kind of the autumn of your life as things are starting to slow down a little bit. Your hormones are changing. Your body's becoming less fertile. Excuse me. Your body's becoming less fertile. And if you think about it in terms of seasons, then autumn is where things kind of, excuse me, really unprofessional, just having a little drink just to get rid of the frog in my throat. But yeah, the autumn of your life, that's when things are starting just to slow down. Things are kind of just feeling as if they're kind of getting a lot calmer, a lot crisper. That's essentially what the perimenopause journey is. A lot of women don't have such an easy ride of it. That I've just made that sound. A lot of women have a lot of hormone fluctuations during this period. So if you're getting symptoms naturally, this is probably when you're getting your symptoms in that perimenopause stage. Obviously, it's very, very different if you're entering an induced menopause, and I'll talk about that in a second. But that's the first stage of natural menopause. Menopause officially happens when you have not had a period for a year. So your estrogen levels, your progesterone levels, they drop significantly and your periods stop altogether. Now, if you are going through a natural menopause, for many women, it's not a case of periods just naturally slow down. You maybe miss a couple, then over a year or however long, they naturally just come to an end. That would be beautiful if that happened. But for many women, you can have more regular periods, you can have heavier periods, they can become irregular even if they've been regular so far. It just depends on how your hormones naturally go through this transition. Obviously, with a surgically induced, with a hormonally induced menopause, that looks a little bit different. Your periods will stop pretty much straight away, especially with surgical, obviously. But your estrogen and progesterone levels are significantly dropped for you. Postmenopause is the phase of your life, that winter phase, if you will, after the periods stop. So that's when your body starts to adapt to life with lower hormone levels. Some of the hormones we don't need. It doesn't mean that they disappear. A lot of women I talk to kind of assume that after menopause, so in the post-menopause phase, they don't have any hormones. But that's not actually the case. It's just the shift in the hormone balance. We don't need the fertility hormones as much anymore, so they drop significantly, but it doesn't mean that the rest of the hormones drop or go away. So there can still be issues post-menopause with hormone imbalance. So with a natural menopause, this transition tends to happen, well, if you listen to Western doctors, tends to happen between the ages of 45 and 55. I know for a fact there are a heck of a lot more women who start perimenopause a lot earlier than this. Some start a lot later, but in terms of Western medicine, it's kind of noted, it's kind of agreed that the normal, hate that word, usual, that's not much better, age of a menopause phase starting, perimenopause phase starting, is between 45 and 55. So when we're talking about natural menopause, even those women who are having symptoms in the perimenopause phase, their body is going through this phase naturally. So it might be uncomfortable, some of the symptoms they might be debilitating, but it's their body's natural process that they're adjusting to. Their ovaries are still functioning, even at a lower level, even after the periods stop, but their ovaries are still functioning, and their symptoms may come in waves. It can be okay for a couple of months, then you might have a bit of a flare-up, but it varies from month to month, and that is the body's natural way of adjusting to the fluctuations of hormones and almost preparing itself as best it can for the post-menopause phase. There's lots of things that can be done. If you are struggling with perimenopause, then please do let me know, because there's plenty of things that you can do to alleviate these symptoms. Things like movement, hydration is key. I know you're probably sick of me saying drink more water. Hydration, movement, stress reduction, all of those kind of things can be massively, massively beneficial. But the key point to mention for this podcast is that perimenopause phase, no matter how uncomfortable it is for some women, in a natural process, this is your body preparing itself for the post-menopause phase. When you have a surgical menopause or even the hormonally induced menopause, your body isn't being given that luxury. So you're having almost in effect a sudden onset of menopause to medicalise it. It isn't really a medical thing. It's a natural transition. It's a beautiful journey. And I lost count of the amount of guffaws and raised eyebrows when I say that kind of thing. But essentially, it is a natural process that we're going through. So if you're bringing about that natural process really, really abruptly, some things don't have a chance to adjust. So you're not giving your body, you're not granting your body that I was going to say easy flow, and I completely get that's, I don't mean to disrespect or disregard or to gaslight women who are struggling on the menopause journey. I'm perimenopausal at the minute. I completely get how some of the symptoms can impact. I'll probably go into that in a separate podcast. So that's not to diminish what you're experiencing. That's just to say that it on some level, it is your body naturally preparing itself. However, when you go through surgical or hormonally induced menopause, you're not giving your body that leeway. You're not giving your body that chance to readjust and to get used to a different way of being. Your hormones drop immediately, I guess. Fairly immediately for some people, immediately for others. So the symptoms that you get around your period stopping as you enter into that post-menopause phase, and this is really, I find this really, really difficult to talk about, because when you say you do, if you're menopausal when your periods have stopped for a year, then by the book, after a hysterectomy, you theoretically should wait a year with no periods to say you're menopausal, but that doesn't kind of fit. Nothing fits when you come to women's health. We don't fit neatly into boxes. So if I'm kind of sounding as if I'm getting a bit confused, I'm just kind of reluctant to define menopause and menopausal and postmenopausal when it comes to induced menopauses. But essentially, if you're removing the ovaries, if you're shutting down estrogen and progesterone, then you're sort of putting your body immediately into that, in inverted commas, post-menopausal phase. And because of that, symptoms can be way more intense. They can be very abrupt. You're obviously, you know what you're doing. You're consciously aware of the decision you've made, but your body might not be caught up with that. Your body might be in a bit of confusion, a bit of haywire as the hormones try to find a way to settle down. So post-op, as you're going through the hormone treatment, it's really, really common to get some quite severe, impactful symptoms. The first thing to say here is just to reassure you that you don't necessarily need to take drastic action. If you can stand the symptoms, then try and mitigate them naturally, try and manage them naturally, try and withstand them, whatever the word is, for as long as you can, because your body will just be trying to recalibrate itself naturally. We underestimate the impact. A hysterectomy is a massive, massive surgical procedure. I know when I go into workplaces and talk about it, a lot of the policies around work, they have the same policy for hysterectomy as they would for, let's say, a knee surgery. But actually, it's way more complex than that. You have the physical recovery from having quite an important organ of your body removed. You have the onslaught of the hormonal shifts. I don't know, hormonal panic. Let's be scaremongering. You have the impact of the hormonal panic that's going on when all of a sudden the ovaries have gone. So your hormone levels drop considerably immediately. Your body isn't having that time to adapt as it would have as you were going through it naturally. So things like severe hot flushes and night sweats, I remember that massively. That is not a comfortable place to be. Sleep disruption, possibly because of the hot flushes, but also just because of your hormone levels. Your hormone levels are all over the place, which makes it a lot harder to rest and relax, which is counterintuitive because one of the things our body needs most at this phase is rest and relaxation, but it can be difficult. You can get the painful sex, the vaginal dryness, fatigue, joint pain, joint swelling even. Your sex drive can diminish completely. I have had a couple of cases over the years where it's actually gone the other way and the sex drive has increased massively. There's no necessarily rhyme and reason for the symptoms that you may experience, but just know that if you suddenly experience massive symptoms, this is not unusual, and it's the body's way of just trying to calibrate as quickly as it can. It's almost like you're putting your hormones into shock, and all they're trying to do is get back to some sort of natural balance. Now, obviously, if you're having a temporary onslaught, not the right word, if you're having a temporary menopause, then you can still get a lot of these symptoms as well. So they mimic natural, the symptoms that you're getting as through the implant or now the daily pill can mimic the natural menopause, but they can be as severe as if you've had surgery, because essentially what you're doing again is shutting down your natural processes. So it may not be as severe as a hysterectomy, but just know again that if yours is, that is not uncommon. And again, so some women after the implant, maybe a cycle or two, exactly the same as coming off the contraceptive pill, maybe after a cycle or two, a month or two, they start to feel back to their normal selves again, hopefully without the symptoms they were struggling with at the beginning. Just know again, though, that some women, exactly the same as a contraceptive pill, can take a few months to recalibrate. So if you're struggling afterwards, if you're feeling as if nothing's changing, if you're feeling as if your symptoms aren't going, just know again that that isn't uncommon. Speak to your clinician, speak to your GP. I haven't even touched on the emotional effects. So when you are, I kind of did actually, I did touch on it. But if you are going through any kind of menopause, and especially if it's a permanent menopause as a treatment, then you can really struggle emotionally. And please know that if you are struggling, please do share, please do talk to somebody who can help you. We have the natural hormonal shifts can cause emotional imbalances as well. As we've seen, especially if you struggle with PMS, PMDD, our hormones are massively linked to our emotional well-being. So the fact that we're kind of, I'm trying to make my language here sort of gentle, but if you're kind of giving your hormones an onslaught of surgery or the onslaught of this implant, then the impact emotionally can be huge just from a biological perspective. But if you then throw in the impact of fear, anxiety, grief and loss around a menopause, the hormonal impact can be massive. So again, please don't struggle on alone. There are so many people you can talk to, be it mainstream mental health services like Samaritans or women's health people like me. Please don't go through this by yourself. But quite often, even if it's an implant, even if it's a temporary menopause, it can really instill a sense of fear and anxiety for the future, especially around fertility. I was told 20 years ago when I was diagnosed with endo that I probably couldn't have kids, which was completely false. But that is sadly still a little bit of a rhetoric around endometriosis. Being faced with a menopause, in inverted commas, in your 20s adds to that fear around your future fertility. So even if it is a temporary menopause you're going through, some sense of grief, anxiety is perfectly natural. If you're faced with a hysterectomy, I hear so many people at the time of making the decision say, I'm not bothered about having children, I don't want to have children, and it's kind of, we put a brave face on it, and actually, you know, that might be 100% certain. I think there's something, and again, this is speaking from my personal experience, there's no scientific evidence to back this up, but part of me does think that a lot of women with endometriosis are so conditioned to think that we're not going to have children, that we deal with the grief, we have an acceptance of the fact that we're not going to have children before the prospect of surgery comes along. However, that doesn't mean to say that in 10, 15, 20 years, you don't have, well, even, actually I shouldn't, there isn't a time scale, but at some point in the future, you may get episodes of grief, a sense of loss, anxiety, upset. All of those emotions, again, are completely valid. Just because it feels right in one moment, and it still feels right, that moment could last for a year, for 2 years, for 6 months, for a day. When you sign that paper, you absolutely know that you don't want to have children, that you're absolutely fine with it. That doesn't mean to say that that has to still be the case further down the line. So please know, if you are struggling with a sense of loss, that is completely valid. And like I say, please do get help for that, because it is a really powerful emotion, a valid emotion, but it can also be quite a debilitating emotion as well. So let's just go through a few myths around menopause. So, too young to be menopausal. This really gets my goat. So menopause can happen naturally at any age. Menopause is very real. At one time, there was a statistic I read that said around a third of women are going through early menopause. That did include surgically induced, hormonally induced menopause. But around a third of women are under 45 as they're going through menopause. So don't listen to anybody who says you're too young to have a menopause, especially if they're a medical professional. Menopause is just hot flushes. No, it's way more than that, or it can be. So at the minute, there are, I think I just did a Google search, and there was around 36 recognised symptoms for menopause, and they include emotional stuff. It doesn't just have to be physical. That includes emotional stuff like anxiety, rage, absolutely, joint pain, dry skin, inflammation, digestive issues, heart palpitations. So quite often it can feel a little bit like a panic attack. These are all recognised symptoms of menopause, so it isn't just a case of hot flushes. It's all downhill after menopause. I hear this quite a lot. No, that's not true. This is a natural transition. It's not a decline. It's not a medical emergency. It's not even a medical procedure or process. It is a natural transition. And many women naturally don't have any symptoms as they go through it. And even if you're having surgery, if you're having an implant that's bringing on the menopause early, that doesn't mean that it gets worse, that life gets worse, that symptoms get worse afterwards. Okay, the actual transition might be a bit harder for you because everything's just going haywire at the beginning, but actually post-menopause can still feel like a new dawn. Post-menopause, most women will experience or report experiencing feeling a clarity of mind. They feel clearer in themselves, they feel more like themselves, they feel more able to express themselves. Physically, they feel stronger. Emotionally, they feel stronger. It's a new dawn. It's a new dawn. Sounds like a film. It's a new phase. It's a new season, if you will, of life. And just because you're having your menopause brought on earlier than you would have done had you been going through it naturally, doesn't mean that it's going to look different for you. HRT is dangerous. A lot of people think that I am anti-HRT. I'm not at all. HRT can be life-changing for women. Protective as well, especially if you're going through an early menopause, especially if you're going through an induced menopause, then there can be risks, and sometimes significant risks, of other things happening later on as a result of your drastically changed hormone levels. So HRT can be preventative for many women. The only thing I'd say is to carefully consider and discuss with your clinician the risks versus the benefits for your own specific case. Because quite often, if you are going through an early menopause because of your endometriosis, if you've got a hormonal element to your endo, then backfilling with HRT can actually reignite your endometriosis symptoms. So be very, very clear on your personal risks before you agree to take it. There's different types of HRT as well. So if one type of HRT is unsuitable for you, please do look at different types, because there probably will be one that mitigates most of the risks for you. And then another myth, the last myth I'm going to talk about, is natural processes aren't, or natural remedies, natural therapies don't help at all. That's not a myth. No, sorry, it is a myth. That's not true. There are many, many natural and collaborative tools that we can use that make a huge difference to menopause symptoms, be that a natural menopause or an enforced menopause. You don't have to tough it out. You don't have to go through this yourself. There are tons of things you can do to mitigate symptoms. So I'm just going to give a very quick overview of a couple of things that you can do. So things like journaling, meditation, Reiki, Tai Chi, doing breath work, anything to calm down your nervous system, to integrate that vagus nerve into your self-care practice, reduces anxiety. That has a massive impact on things like hot flushes, your ability to sleep. If you want to go deeper into the world, then things like having rituals, cacao ceremonies, ancestral healing practices, that can also help with any major sort of identity shifts, any kind of any deeper kind of healing that needs to be done. Also things like abdominal massage, acupressure, acupuncture, that can help rebalance your hormones. It can also help with your pelvic health. Gentle movements. I don't talk a lot about exercise, as you know. I'm more about movement. So if you can incorporate Tai Chi and any sort of gentle walking, mindful walking, that has massive implications when it comes to reducing inflammation and boosting your emotional well-being. Things like herbs. There are things that you can have that you can add into your diet. Teas are lovely. Again, please do speak to a qualified herbalist rather than getting over-the-counter one-size-fits-all remedies, because one size doesn't fit all necessarily. Just because they're natural doesn't mean they are always safe for you. So if you can speak to a medical herbalist, please do. But the use of herbs and adaptogens and things are massively, or can be massively beneficial. Nutrition, eat seasonally. Eat, if you find yourself with digestive issues, eat little and often rather than big meals. Water is hugely important. Really, really up your water intake. If you think about these as seasonal journeys, then autumn and winter, things do tend to dry out. We need to water the plants a lot more as it comes to the sort of the height of summer, comes down into autumn, things start to dry out. So you need to maintain your water intake massively and increase it in most cases. Eat things like chickpea, healthy fats, leafy greens, vitamin B, magnesium can be huge as well. Again, they can be game changers, but just be mindful of getting that tailored approach to exactly what you need for your symptoms and your journey. And then practical tools, things like cooling sprays. Peppermint's lovely for cooling. Clary sage, lavender, again, just be really careful. Just if you can, speak to an aromatherapist just to make sure that they're going to be relevant for you, that they're not going to have any contraindications for you. Things like natural clothing, cotton, linen, loose-based clothing, things like that can be really beneficial as well. So, lastly, just to say, if you are facing an induced menopause, then please know that whatever emotions come up are completely valid. Natural menopause is a rite of passage. It isn't a medical event, it is a journey, and all you're doing is going through that at a colossal pace. But that doesn't mean that you still can't honour it, you still can't enjoy it, and really do honour that journey. Self-reflection and journaling, what are you letting go of? What are you stepping into? So give it some thought. We feel a lot of the time as if that power has been taken away from us, but there are things you can do to reinstall the power in that journey. So journal to yourself, what do you want to leave behind from this stage of your life, and what do you want to invite into the next stage? Reclaim that power. Take that shaping of it as much as you can. Talk to yourself softly, be very, very gentle, and there can be emotions of shame and, like I say, guilt and loss. Honour those, but don't dwell on them. If you find yourself dwelling on them, if you find themselves weighing heavy, then just try and shift it. Try and let go of them through journaling, through somatic movements, just gentle movements, Reiki meditation, and just talking to somebody who can actually genuinely help you as well. So, if you are going through this journey, you are not broken. You don't have to go through this alone. There is no right way through it. Everything you're experiencing is completely valid. Just be really, really gentle for you. There are people like me out there who can walk this journey with you, who can guide you through it, but you don't need to. You are perfectly capable, and everything you're feeling is perfectly valid. So I'm going to put in the I'm going to put in the show notes a complete menopause bundle. If you are interested in natural ways of managing your menopause journey, especially if that's an enforced one, then that might be worth a look at for you. If you use, as with all of these podcasts, if you use code podcast when you get to checkout, that will give you a lovely little discount as well. So, whether you are experiencing a natural menopause or whether you're facing an enforced menopause, either temporary or permanent, I wish you every luck and every joy with your journey. It doesn't have to be the roller coaster that many women fear. There are things you can do to mitigate, but I just wish you every happiness in your post-menopause winter phase.